So next I call upon Dr. Ashish Pandey. Dr. Ashish Pandey.
I think in place of Ashish Pandey, you are presenting. She is presenting in place of Ashish Pandey.
Okay.
So we just write her name.
Okay. Madam, what is the reason for changing presenting authorization?
Change of position. You know, yeah, now that she's yeah.
I'll be presenting on the behalf of Dr. Ashish Pandey. So my topic is Ethambutol induced optic neuropathy, a retrospective study of incidence and risk factors. So tuberculosis, which is considered as a global health concern and include 4 drugs, which is rifampicin, isoniazid, pyrazinamide and ethambutol. So due to revised RNTCP 2016 guidelines, which consist of daily regimen of ethambutol, so the concern has raised about ethambutol-induced optic neuropathies. So ethambutol has a bacteriostatic action. So because of ethambutol-induced optic neuropathy, age is likely to be considered as a risk factor for the complication of optic neuropathy. So my study aims to assess the incidence and risk factors of ethambutol-induced optic neuropathy. So in this retrospective observational study, which was conducted in DOT Center, AIIMS Bhopal, from duration 2019 to 2023, a total of about 1,676 patients were recruited, out of which 986 had an ophthalmology encounter. So all of the patients received ethambutol treatment, and the demographic data was collected. We collected BMI history, smoking history, any age, gender, any medical history relevant to that, any ophthalmic data in patients of ethambutol-induced optic neuropathy. OCT records was also calculated. So the results were, all of the patients had bilateral painless vision loss, and the visual acuity ranged from 6/24 to hand movement close to face. And there was no correlation with gender and age was found. And 6 patients amongst 13 patients who had ethambutol-induced optic neuropathy were found to have red-green color deficiency. So after cessation of ethambutol also, only 1 patient was found to have visual acuity improvement from in 2 lines of Snellen's chart, with a mean recovery time of about 9.4 months. And all 13 patients had temporal disc pellar. The average RNFL thickness in right eye and left eye about 69.54 plus minus 3.07 micron, and 69.54 plus minus 2.67 microns. So these are the association of socio-demographic variables in which we included age, gender, BMI, treatment duration, comorbidity, addiction history, serology, ethambutol dose, number of fixed dose tablets, and type of tuberculosis, which was not found to be significant in our study. In linear regression analysis, the socio-demographic variables such as increased left temporal RNFL thickness and increased average RNFL thickness was found to be associated with the duration of ethambutol. So I would say that there was no significant difference in the age group we found, as in contrast to the previous studies, which suggest that age is correlated with the high correlation of ethambutol-induced optic neuropathy. And we also did not found any correlation with hypertension and smoking, which is considered to be a risk factor in previous studies. So according to previous meta-analysis, duration and doses of ethambutol was correlated to the risk of ethambutol-induced optic neuropathy. Our study also suggested that though this association did not persisted in unadjusted models, so it might be due to the prescribed ethambutol regimen, which was about 15 to 25 milligram per kg per day. So in conclusion, we did not find any significant difference in the age between patients with ethambutol-induced optic neuropathy and without ethambutol-induced optic neuropathy. And despite the revised RNTCP guidelines, which considered daily regimen to eliminate TP, there was no increase of incidence in previous guidelines, and these guidelines was seen in our case. And the toxicity of ethambutol is in our case was dose and duration dependent, with no dose being absolutely safe. So with this, thank you everyone.
Thank you.
Thank you.